Thank you so much for coming in today for this little interview. Would you be able to share with us your medical history?
Sure, would you? Not the whole thing.
No.
It goes for years and
In a
years.
nutshell.
My recent medical history. In probably November last year, an SCC, a squamous cell carcinoma, was detected on my scalp. And so I went to a surgeon, and about the same time a lump appeared under my jaw here. And the surgeon wasn't sure whether they were related, but it seems like they were. A biopsy was taken. It turned out that this is an SCC, so the presumption was that they were connected. The procedure then the surgeon chose was to take out the parotid gland from my left side and other glands from my right side of my neck, and follow the lymph node, channel down my shoulder a bit. So he's taken out the lymph gland down to my shoulder. Yes, there was a biopsy taken there and a biopsy taken on my scalp. After they were taken, I went to radiotherapy and have been in radiotherapy, just about to come into the end of it now. So 40. I've had 40 sessions of radiotherapy, and there's a few more to go. They were interrupted by the fact that another site on my forehead, just near the hairline, was detected. It was tested, and that was an SCC too. So my treatment in radiotherapy had to be continued. So that pretty well is where I am at the moment. I have, the effects of that have been, well, the normal side effects of radiotherapy: dry mouth, taste buds, saliva glands have been damaged or reduced. And also, as a result of the surgery, a good deal of stiffness, numbness on either side of my face, and particularly on the right-hand side here, have been part of the effect of all of this. And that was why I was recommended to you enthusiastically. So I came down here, and we've been working on that sort of thing.
So just to recap, there are a few sites currently that we're working on.
Correct.
So there is some tightness across the scarring from the parotid gland from the removal, which also impacts a little bit on the closure of the left eye due to some damage of the facial nerve. Then we're working on the shoulder range, and there's a little bit of limitation of the movement of your shoulder on the right hand side, and some stiffness and tightness of the neck, some swelling under the chin, and we're currently leaving the head out of the equation. There's not really much anywhere that physio can do at the moment, because it's radiated and it's sore and red. But so there are a few things that we're currently working on together. And the regime currently involves some exercises that you are doing with gentle weights and resistance band for your right shoulder, some self-massage for the facial nerve and also for the tightness. And then tell us a little bit about your swelling under the chin. How is it impacting? Has it changed over the last couple of months, and what are you currently doing for it?
One of the effects of radiotherapy, of course, is the skin is under this area here is affected and made fairly sensitive. And so I've been putting a number of lotions on the skin, but at the same time, not sort of deliberately massaging, but conscious of the swelling under my jaw. And so I've been lightly sort of massaging that as I put the ointments, if I could call them that, onto my the affected area of skin. I haven't noticed the swelling here. I think you've been a little more conscious of it than I have, actually. So it has been a significant characteristic of what I'm trying to deal with. But it is swollen. You quite right.
It is swollen. And I, sorry to interrupt you, I think it's also partially probably due to the fact that there are more significant functional limitations that you're currently experiencing. So the shoulder movement, for example, will impact on your day-to-day more than the swelling that's accumulating here.
Exactly.
And so, and because also I deal with swelling much more, so I'm, you know, more in tune, I guess, with, you know, what's happening in terms of the swelling. And in terms of managing the swelling, you mentioned the massage, and there is a particular direction that we want the massage to go, so away from the affected side to the other side.
Right.
Yeah. So that's, I think, also.
So
Do you feel like you are managing currently quite well with everything?
I am. One of the side effects of radiotherapy, which is most annoying, is the damage to taste buds, and now we can't do anything about that at this level, I imagine. But probably that's the most unmanageable part of this whole exercise, because I can't. I eat without in any relish at all, which is annoying. In terms of the exercises you've been giving me and suggesting, I think that I feel the effect of that, and I feel that it's working on this shoulder and this frozen area of my neck and shoulder that's here. I think that's been very effective there. I think in one of our conversations you were talking about my voice and my swallow. I don't think I've got a problem with swallow. My voice is just a tiny bit affected, but nothing to write home about. And I'm sort of recognise that, in fact, radiotherapy as a powerful sort of tool is working around some pretty sensitive areas around my throat and mouth and that sort of area.
Okay, well, we'll keep marching on. We'll keep on the road of recovery.
Yeah, good. Thank you. Thank you for all your help too. It's been interesting, and it's interesting, you know, when you talk to the surgeons, they give you a certain amount of information, but there's so many other areas of interest that you've been very illuminating.
Thank you. That's great to hear. Thank you so much for participating.
Good. Thanks, Oshi.
Thank you.